3/4 of people who are 75 and older have high blood pressure. Having high blood pressure increases the risk of heart attack, heart failure, and stroke. A new study examined what would be the best target blood pressure to reduce the risk of these complications in older adults.
This health tip is brought to you by
Desert View Hospital and Mountain Valley Physicians Group. Don't put your health on hold. We have time for you. Call us to schedule your appointment. 775-751-7100.
Living independently is important to Mary Powers and her husband of 63 years.
We're still in our home and we have a garden. We travel a little and enjoy life.
Like a lot of people in their 80s, Mary has high blood pressure. She works with her doctor to manage the blood pressure so she can be as healthy as possible for as long as possible.
The most common reasons that people end up losing their independence are often complications of hypertension.
Dr. Jeff Williamson from Wake Forest School of Medicine and co-authors released the latest results from the systolic blood pressure intervention trial, also known as the SPRINT trial. They enrolled more than 2,600 people 75 and older. All participants were living in their own home and could get back and forth to the doctor. They were randomly assigned to 2 groups.
We wanted to test and see whether a systolic blood pressure target of less than 120 millimeters of mercury, that's the top number measured in the doctor's office, was more effective than 140 at reducing the risk of stroke, heart attack, heart failure, and death.
In addition to recording those outcomes, researchers monitored blood pressure along with memory skills and the ability to walk a little more than 13 feet every 3 to 4 months. The trial was scheduled to run 5 years.
After just over 2 years, the study was stopped by the National Institutes of Health because we found a strongly favorable result in those individuals assigned to a blood pressure treatment target of less than 120. A blood pressure target of 120 systolic is much more effective than a target of 140 in reducing the complications of high blood pressure.
Even those individuals who were somewhat frail appeared to benefit from the lower blood pressure target.
This should remove a great deal of confusion for patients and their physicians about what the blood pressure target should be for older people.
Mary's blood pressure has been well controlled, and she has just one word for how she feels these days.
Great.
Catherine Dolf, The JAMA Report.
To achieve the lower blood pressure goal, participants required, on average, 1 additional medication per day. 90% of the medications used were generic. Cardiologist Dr. Tali Arik explains the advantages of having a local specialist.
Pahrump has one of the highest percentages of people over the age of 65 of any community in the United States. According to the Census Bureau, it's 25%. So that's a tremendous percentage and much higher than the average in the United States. So these are people who invariably are going to have cardiovascular problems. About half of the population over 65 is going to have an active cardiac issue. So managing that, getting advice about that, getting tested for that, would all involve going to Las Vegas, which it has been for years, until I came here, until Dr. Siegel preceded me here, who was providing those services too.
And then, can you describe some of the challenges in providing cardiology in our community?
Well, there are many. As a cardiologist, one is used to working in a big city environment where when anything happens, you can rely on a big hospital with cardiac laboratory, surgeons, etc. So when you work here, you have to be very creative about how you use services, who you decide really needs to go to the big city for advanced care. And I think one of the advantages of having someone like me here who has worked in small towns for almost 30 years, in addition to working in big city hospitals, is you know when someone really needs to go. And bringing that expertise here, we've actually substantially decreased the number of transfers from Pahrump to Las Vegas. The hospital has that data. I think it may be 30 or 40% decrease.
What's the kind of criteria that you have decided? Because I'm sure that there's a whole different type of level of care of what you decide this person needs to be transported and this person can stay.
Well, I'll give a very concrete example. A person goes to the hospital with chest pain. This is a common reason to go to the hospital. We know 50% of chest pain episodes are non-cardiac. Previous to us having this program here, many of those patients were simply transferred for the evaluation, Now with echocardiography, with sophisticated nuclear medicine, which is as good, frankly even better than some of the institutions in Las Vegas, we can do that initial screening here in Pahrump, and many of those patients can then be safely discharged the same day or the next day from the hospital.
So are you here full-time then
I
now?
am. I live here, and I work at the hospital 5 days a week. We divide the weekends up between myself and Dr. Siegel, so we actually have coverage 7 days a week.
With the rising awareness of mental health needs, we are offering our support services to those who may be struggling and looking for answers. Please submit your questions via email, Facebook, fax, or phone so that our licensed psychologist from Southern Nevada Counseling Center can address your issue over the air during our newscast on kpvm.tv or KACE Radio. Your identity will be kept confidential. Your questions are important and may help others dealing with the same difficulties. Your questions will be answered on Tuesday's broadcast. The phone number to call, 775-727-9400, extension 201, or you can email me, Deanna at kpvm.tv. Leave a message on our Facebook page, which is facebook.com/news41, or you can even send us a fax at 775-727-8750. You may have seen it traveling through town, the Nye County School District Lunch Brunch Bus. We caught up with the group during one of their stops at Comstock Park.
The Lunch Bunch we have our new bus that we started this school year, or this summer, that we funded through the food service program for Nye County School District. We've been doing the summer feeding program for many years now. We felt the need to start going out into the community with a mobile feeding. For 2 years now, we use the school district's mail van to do it, to pilot it, to see if it was going to work out. We average about 125 meals a day, and in using that monies that we've received for the last few years for the mobile feeding, we were able to purchase this bus and get it retrofitted so that we can now serve even more meals. We added another site this year. Last year we were doing 3, and this year we're doing 4, and hope to maybe add some more sites next year if all goes well.
So where do you guys go now?
Where do we go from here? We go to Patrick Park, and then we go to Simpkins Park.
And then what other site did you guys add to the route?
We actually start at the Comstock apartment, or not the Comstock apartments. We start at the Dandelion apartments, exactly, Courtyard apartments, and then this is our second stop. Then we do Patrick Park, then we do Simpkins Park.
It's fun, just really hot.
Yes.
It's hot.
Very hot.
But
like
we have fun. You gotta make fun of it. And each stop is different. All the kids, they're fun to see. We tease them, they tease us. We have fun with it.
We have a dog that's looking for a home when we return.